Final presentation, The 10 Essential Services of Public Health by Jessica Benet, Leslie Buchanan, Jackie Faley, and Kenneth Hollingshed. This is the A-Team's final presentation to the 10 Essential Services of Public Health. We will be covering assessment and policy development actions in this presentation. Most children living in poverty are in an inner-city environment. These communities lack public resources, economic investment, and the political power needed to help families in this area. Children who are poor have higher rates of hospital admissions, disability days, and death rates. They have inadequate access to preventative, curative, and emergency care and are affected more frequently by poor nutrition, single-parent families, dysfunctional families, and poor housing. Even though New York City children living in poverty are subjected to a multitude of hardships mentally and physically, a healthy mind and body can be accomplished through education, health care, and a stable home life. The target population is children under the age of 5 who are living in poverty in New York City. Like adults, children will be affected by poverty as well. Their health can suffer as a result of parents who do not have the funds available to get them the health care they need. The biggest problem is lack of education of the parents. This means they will earn lower wages, and with the decreased value in those wages, they will continue to struggle. There has also been a decrease in government assistance, with only 20% going to families that are poor. Children living in poverty will often have living situations that are not conducive to a healthy lifestyle. Living homeless and in low-income housing will often mean that the home is not stable and therefore cannot have a healthy routine established. Education gives children the foundation for a hopeful future. A healthy mind is as important as a healthy body. Health care for children of poor families is not consistent or proactive. Preventative care is a luxury the poor cannot afford. Hunger promotes malnutrition. Malnutrition results in poor health. Homeless children receive almost no preventative care, becoming sick more often because they are born under conditions that promote illness. Preventative care and proper nutrition for children in poverty will allow these children to have a fighting chance at a productive, stable future. In 2006, the Administration for Children's Services created the Office of Safety First, a special hotline for mandated reporters to ensure clear and direct lines of communication between the reporter and the ACS staff. The purpose of this office is to address ongoing safety concerns and to facilitate a partnership between CPS and the mandated reporter in the best interest of the child. The United Way's Poverty to Possibility movement is aimed at fighting childhood poverty by helping families realize the value of their children's education. New York City launched Early Learn NYC as a way to provide subsidized child care to working class and low-income families. Having this in place would help give parents peace of mind and also allow them to interact with professionals who can help guide them to better choices for their children. The Children's Defense Fund was set up to help combat childhood poverty in America. The CDF fights for funding for policy change to help children in need. Responsibility for health involves a multitude of stakeholders. Healthy outcomes cannot be achieved through the efforts of one individual or one organization. To reduce the risk associated with children subjected to impoverished condition requires an expanded community effort. The stakeholders should include the parents, community health nurses, hospitals, public health organizations, schools, and housing organizations. Utilizing planning models such as multi-level approach to community health MATCH, which includes goal selection, intervention planning, program development, implementation planning, and evaluation, are a good way to get the community involved in healthcare efforts and outcomes. To educate the community on what their role is as it pertains to public health is indicative of what public health is. Educating the parents as to what they can do to keep their children healthy, be that environment or what services are available to them, is a step in the right direction. Knowledge is power. By giving them the tools and guidance, you will be empowering the community as a whole in this thing that is public health. By gaining community alliances, you make the possibilities even more powerful. There is strength in numbers. The more partnerships that can be formed, the better chance you have for a productive, healthy community. Children in the inner city are already at a disadvantage, and at such a young age, it is a must to combat the impoverished conditions that they see every day. New York City is a very big metropolis, and the children are our most valuable resource. If the community pulls together someday soon, we can tackle this troubling issue. This concludes our first presentation. Here are the references.